You've been prescribed metformin with promises of a better life, but instead all it has done for you is actually make you hold on for dear life, probably more often than you think. Hey everyone, my name is Dr. Dan, and today we're going to be going over the 4 easy solutions of getting rid of those metformin pesky side effects. Now, option number 1 is really for those patients, for people like you who are watching this video who just got diagnosed with diabetes. A lot of the times our lovely providers would like to jumpstart you on a high voltage, high octane dose. What they fail to remember sometimes is that it's better to build a tolerance to metformin than putting you straight on such a high dosage. With the help of your provider, dial back that dose. Start off with 500 milligrams once a day for the week. From there, you can follow up with your provider to see if you want to increase that 500 on the following week or even 2 weeks after you first started. What that really allows your body to do is to slowly build that tolerance. Option number 2. For those of you who just started and you're trying to go up in that tapering process of increasing the dose, or maybe you've already been on metformin for quite some time, one thing I always like to recommend to everyone, and something that even some of us forget to do, make sure to eat it with a meal. And when I say a meal, I'm not saying all you can eat at Sonny's Barbecue, and I'm also not saying on the flip side of things, some carrots and some bird feed on the side. What I'm talking about is a nice healthy meal. We're talking 25% protein, 25% vegetables, and of course 50% of a healthy starch. Once you consume that meal, then take your metformin and hopefully you won't have those pesky side effects. For option number 3, this is where things get a little bit more complicated, and I'm not going to try to get too scientific here. But we need to know is that the metformin that all of us pick up at our lovely pharmacies happen to be immediate release. So just like the name says, immediate means that pill, the second it hits all that lovely content in your stomach, it breaks down and you get the full effect of it. However, sometimes our providers forget there is an alternative to immediate release called extended release. And just like it says in this thing, once you take that first pill, it is slowly and gradually broken down, giving you the protective effects of metformin throughout the day with less side effects. The last and final solution that I truly recommend having a conversation with your doctor over is for those patients who've tried those first 3 solutions. This is where we actually consider using another medicine. So when it comes to choosing what we put diabetics on, for example, we reference the ADA guidelines. When you mention that to your provider, they will be very familiar with those 3 lovely letters, because everything in the medical community happens to have an acronym and we all need to know what it is. But essentially, if a patient is struggling with metformin, there happen to be 2 other drug classes that can really help you out with sometimes even better results and less side effects. One of the other alternatives is your GLP-1 agonist. I promise not to get too scientific here today. However, if you mention that class to your provider, they'll be very familiar with what it is. Essentially, just to kind of give you an idea of what a GLP-1 agonist is, it's our lovely drug Ozempic, which has taken over the world for their weight loss properties. Now, one thing I will say, it is an amazing drug. A lot of people are getting a lot of benefits off of it. But because of how popular it is, it may be really hard to obtain. There are other alternatives, so make sure to talk to your doctor about the other GLP-1 agonists. But one of my favorite classes happens to be called an SGLT2 inhibitor class. Again, lots of acronyms like I just said a few minutes ago. Now, what I love about this class is that there are several options. It does not require a needle, and it actually happens to be affordable. On top of that, this pill truly brings a lot to the table. Not only are you going to have protection in your glucose control, but also these medications have been proven to not only protect your heart, but also to protect your kidneys. So this is something to bring up to your provider and just ask them, what other options can you recommend to me? For today's video, I truly tried to be as specific and as direct as I possibly could. If you want to be more scientific, let me know in the comments. And of course, if you want more tips and tricks and to simplify the complex world of medicine, make sure to subscribe to this channel. I'll see you on the next time.